Hello everyone, this is Dr. Kazi, and in this video we are going to learn about the anatomy of the thyroid gland. So let's get started. This gland consists of two lobes, the left lobe and the right lobe. These two lobes are connected with each other by this narrow portion in the middle, which is known as the isthmus. Now, whole of the thyroid gland is surrounded by a sheath which encloses the gland, and it connects this gland with the trachea and the larynx. The thyroid gland consists of the apex. Now this is the apex, and the base. The apex is directed upward to the level of this oblique line. Now what is forming this oblique line? Oblique line is formed by this thyroid cartilage. This is the thyroid cartilage forming the oblique line, and this oblique line is the boundary of the apex. Now the base is at the level of 4th and 5th tracheal rings. The tracheal rings are present inside the trachea. These are cartilaginous in nature, and it prevents the collapse of trachea. The isthmus, which is connecting the right and the left lobe, this isthmus is at the level of the 2nd, 3rd and 4th tracheal rings. Now, sometimes we have an extra lobe which is extending from the isthmus. This lobe is known as the pyramidal lobe. If we divide the thyroid gland, the midline, to the left of the midline, we have this pyramidal lobe. The hyoid bone is connected with this pyramidal lobe by a fibrous muscular structure, and if it is muscular in nature, it is known as glanduli levator thyroidi. This is the name of the muscle which connects this pyramidal lobe with this hyoid bone. Let's have a look at the anterior relation of this thyroid gland. This is the cross section at the level of the C6 cervical vertebra. Let's have a look. This is the thyroid gland, which is shown with the red color, and anteriorly, more specifically anterolaterally, we have the group of muscle. Let's have a look. This is the very prominent muscle in your neck, which is known as the sternocleidomastoid muscle. Now, thyroid gland anteriorly, immediate anteriorly to the thyroid gland, we have the sternothyroid muscle. Now, beside this sternothyroid muscle, we have the sternohyoid muscle. Now, the omohyoid muscle is located laterally towards the thyroid gland. So this is the omohyoid muscle. Let's have a look at the anterolateral relation from another angle. This is the most prominent muscle in our neck, which is bounding the thyroid anterolaterally, and it is the sternocleidomastoid muscle. This is the thyroid gland. Now, the muscle which is laterally to this thyroid gland is the omohyoid muscle. This is the sternothyroid muscle and the sternohyoid muscle. Let's have a look at the posterior-lateral relation of the thyroid gland. What is posteriorly and laterally to this gland? Very easy to understand. There are two major vessels posterior-laterally to this gland. Internal jugular vein, have a look, this one, and the common carotid artery. The common carotid artery also includes the carotid sheath. So posterior-laterally, we have three structures: the internal jugular vein, the common carotid artery, and the carotid sheath. Let's have a look at the posterior-lateral relation from another angle. The internal jugular vein, correct, and the common carotid artery is bounding the thyroid gland posterior-laterally. We have talked about the anterior-lateral relation and the posterior-lateral relation. The anterior-lateral relation includes this part, and the posterolateral relation include these two vessels along with the carotid sheath. Now, what is on the medial side of this thyroid gland? Medially, we have trachea. Now, this is the trachea, which is on the medial side of the thyroid gland. Behind the trachea, we have the esophagus. Now, esophagus and the trachea have a little groove in the center, and this groove is a site for this nerve, which is known as the recurrent laryngeal nerve. Let's have a look at the blood supply of this thyroid gland. We know that this is the arc of aorta. Now, this arc of aorta is giving us three branches: left subclavian artery, left common carotid artery, the brachiocephalic trunk. The brachiocephalic trunk is dividing into two branches: the right subclavian artery and the right common carotid artery. Now, from the right subclavian artery, a trunk arises, which is known as the thoracocervical trunk. Now, this thoracocervical trunk is giving us the inferior thyroid artery. Let me change the color for better understanding. This is the inferior thyroid artery, which is supplying the lower lobe of the thyroid gland. The right common carotid artery is ascending, and it is giving us two branches. One is the internal carotid and the external carotid. The external carotid artery gives us the superior thyroid artery, which is supplying the upper pole of this thyroid gland. Sometimes we have an artery arising from the brachiocephalic trunk. Have a look. And this artery is supplying the center portion of the thyroid gland known as the isthmus. Also, we can have this artery arising from the aorta as well. Let's have a look at the venous drainage of the thyroid gland. Very easy to understand. There are only three veins which are involved in the venous drainage. This one, superior thyroid vein. This one, middle thyroid vein. And this one, the inferior thyroid vein. The middle and the superior thyroid vein are drained into the internal jugular vein and eventually into the inferior vena cava. But the inferior thyroid vein from both sides, they form anastomosis. And this anastomosis is connected with the brachiocephalic vein. This is all about the anatomy of the thyroid gland. If you like the way I teach, please do like, share and subscribe. Also leave the comment, and